The whole toilet paper thing is I don't get it. Hey folks, this is former Navy SEAL Cade Courtley here for Patriots. A little over 10 years ago, I was the host of a TV series called Surviving Disaster, in which we gave advice on what to do if you found yourself in a life-threatening situation. Now, the final episode we shot was on pandemic. I went back and watched that episode again, and I was pleasantly surprised how relevant and current and accurate the information was after a decade. Since this started, I've gotten numerous phone calls based on my background and being in the survival space. What should we be doing? What advice do you have? Number one recommendation: remain calm and be patient. This is the foundation for any life-threatening survival situation, remaining calm. Anxiety, fear, panic, it's the worst way to react to a situation like that, all right? You need to be able to think logical and react appropriately. And if you let yourself get worked up, neither one of those things will happen. There's a very simple thing to do to help you with anxiety and fear. It's called combat breathing. Inhale for 4 seconds, exhale for 4 seconds, and repeat. It fortifies your body and your brain with blood, and it honestly takes your mind off something you shouldn't be thinking about probably. Number two, this is a big one: supplies. 95% of surviving any disaster is preparation. Yes, toilet paper is nice to have. Is it a necessity? No. Are you gonna die if you run out of toilet paper? No. Is it gonna be pretty? No, but enough of the stocking up on toilet paper. Let's tell you what I recommend you do stock up on. Number one, medication. There are millions of folks out there who need prescription medication on a daily basis. I'm recommending 2 months. That would be a conversation you'll have to have with your doctor or physician. But if you can get them to have you write a script so you will have 2 months of this vital prescription medication, that's excellent. Many of us potentially are going to get sick, but it will not require a visit to the hospital or the emergency room. Act as though you just got the flu and think about what you would need as far as over-the-counter medication, decongestants, expectorants, things for cough, things for fever reduction. So think about that sort of thing as if, okay, I've got it. I don't need to go to the hospital. I'm just going to go ahead and deal with this on my own and get through it. Okay, here's the big one. And number two, food. If everybody went to the grocery store and loaded up their van with food, there wouldn't be enough for anybody. So let's start with enough for 2 weeks. I recommend non-perishable food, canned goods, rices, pastas, beans, and frozen food. If you can find some meat and poultry that can be frozen, and that can be used at a later date, and again, it will last for a long time. PPE, which is a term many of you become familiar with recently, or personal protective equipment. If you are following the recommendations of staying home and social distancing, you really aren't going to need any personal protective equipment. All you will technically need is hand soap or Purell if you can find it, maybe a bleach, a Clorox-based solution for cleaning surfaces. There's a little secret most people don't know about. It's called HibaCleanse. It's great. It's an antiseptic, antimicrobial skin cleanser, very effective. You can find it by the first aid supplies. Since I'm talking about first aid, this is also something that you want to make sure you have enough of. So here's the deal, and in wrapping this section up here, we are in uncharted territory. Listen to the recommendations of those in the medical field. We will not only survive this pandemic, but we will thrive. It will happen sooner than later, and we will be better. Be a survivor, not a statistic. It's Cade Courtley out.